Okay, welcome back everyone to the Texas A&M Dermatology Interest Group's Residency Program Series podcast. Today we are hosting Dr. Luke Horton. He is now a PGY4 at University of California, Irvine Dermatology Residency Program. Welcome, Dr. Horton. Thanks for being on the podcast today.
Thanks for having me. Can you just call me Luke through this? It feels like
Yes.
a
Yeah.
little bit like formal, but anyway,
Yeah, no
yeah.
worries.
Thanks for having me, Kiva. It's great to be here. Happy to talk about Irvine. I love it here. And to anybody listening, I hope you guys come.
Awesome. Thanks, Luke. So tell us about yourself, kind of who you are, where you're from, where you did undergrad and med school, so we can get to know you.
Yeah, I mean, my name's Luke Horton, obviously. I grew up in the Midwest, in Illinois, like a little west of Chicago. Did my undergrad in California, two places actually, Occidental College and Claremont McKenna, which is where I graduated from. Did my med school in Michigan at a place called Wayne State in Detroit. I did not do a research year. I got involved in research early, just like um, knowing that I might want to do something competitive, and got lucky essentially um, through the interview process and things like that. And then I did my intern year at Memorial Sloan Kettering in New York, and then now I'm a PGY4 at UC Irvine, and I'll be applying Mohs surgery. Well, I am applying Mohs surgery, um, and going through kind of the application process right now.
Awesome. Good luck. Well, it sounds like your interest within dermatology is Mohs. Do you have any other interests within dermatology, and what are some things you like to do outside of derm?
Yeah, good question. I mean, anybody who's listening to this probably is already kind of sold on derm, but it's a great specialty for anybody who isn't yet. When I went to med school, I thought I wanted to be a pediatric oncologist actually, and then I decided that was way too sad. So I like went through a bunch of other things. I thought about ortho, I thought about ENT, I thought about plastics, and I ended up in derm because it lets me do a lot of things that I want to do, which is like a very broad specialty in terms of like you get to see babies, you get to see geriatrics, you get to do surgery, you get to do medicine, you get to do pathology. And then frankly, it lends itself to a lifestyle that lets you have a life outside of medicine, which I know you're not supposed to talk about in interviews or whatever, but it is an important consideration for a lot of people. Um, so dermatology just offered me everything I wanted to do. And then my interest was always in cancer, and then obviously within the field of dermatology, skin cancer. And I like, working with my hands and kind of like the sort of like artistic aspect of like reconstruction and like cosmetic dermatology. So my interest now, like through this process, has kind of become like procedural dermatology and oncodermatology. But I'm still interested in med derm. I like kids, but probably not like the super rare genodermatoses and things like that. Um, and then I like non-melanoma skin cancer stuff. So that's kind of where like my like research interests are now a little bit more. But I kind of foresee myself being mostly a procedural dermatologist and then also doing some gen derm as well. But derm is a great specialty with it's very broad, so it has a lot to offer, obviously. And then what do I like to do outside of derm? I honestly had a lot more hobbies before med school started, but I like sports a lot, so I play basketball whenever I can. Spending time with my girlfriend, exploring Orange County. There's a lot to do here, a lot to see, and we have a lot of fun exploring restaurants and beaches and things like that. Spending time with my friends, traveling, normal stuff, and something's a good time when I have the time. Yeah, that's kind of it right now.
That's honestly sounds like an exciting life. Awesome. Well, thanks for letting us get to know you. So we'll just start off with learning a little bit more about UC Irvine. So if you can just go through the basics with us, where is it? Where is the hospital? Where are the clinical sites? How many residents and faculty do you have? Is there a med school
Mhm.
or is it just a standalone hospital? So just give us a little bit of the general idea first.
Yeah, great question. So University of California, Irvine is part of like the greater UC system, and then we're obviously based in Orange County. We're the only academic center in Orange County, and one of two residencies here, but kind of the larger one. Um, it is centered like kind of between LA and San Diego, so like roughly an hour south. It's Southern California. It all kind of depends on traffic. So it could be like 40 minutes south of LA, or it could be like 3 hours south of LA, depending on what time you leave. And then an hour probably from San Diego, again, kind of depending on what time you leave. Um, so it is connected to a medical school and undergrad campus. We actually just opened up a new hospital that I was at today, which is in Irvine proper, kind of near the border of like Newport Beach. One of our main clinical sites is near the medical campus, which is also connected to the undergrad campus, called Gavin Herbert Eye Institute. And then we actually have a lot of different sites. So we have some in South Posey, Laguna Hills, a little bit more inland in like Tustin, for example. And then kind of the main body hospital is Douglas Hospital, which is in Orange, which is a little bit, again, more inland. And then we spend a lot of time, about a third of our residency at the VA, which is in Long Beach. So that's like about a 30-minute drive from where I live in South Irvine. And that's about as far as you'll have to drive, basically, in residency. I think you asked how many residents and how big our faculty is as well. We currently have 5 residents a class, but they have applied. I don't know if I'm supposed to say, but they've applied for more coming up. So, and we have like the caseload and volume and to support it. So I think that we should get it hopefully. But so they're trying to get to 6 a class, hopefully. But that's of course like TBD and a lot of things like to come in the future. But it's a healthy program that thinks it can grow, which is a good thing. And our faculty is growing. I think we are adding 5 new faculty this year, and we already have 20 something. So I don't exactly remember the number. It's probably on our website, but well more faculty than residents at this point. You can tend to work with certain faculty more than others, based off of like seniority and kind of like which ones prefer to teach and what they deem to be like the educational value in terms of like the subspecialties that the different faculty have. But you get a lot of different, a lot of diversity, I guess, in viewpoints because of the large faculty here. Did I miss anything?
No, that was perfect. That was a great introduction. Let's go into fellowships a little bit. So, for those who don't know, there's fellowship obviously after residency to subspecialize, but then
Mhm.
there's also research fellowships where students can do research years. So tell us if
Mhm.
you guys have any post residency fellowships, and then also if you guys have research year fellowships as well.
Yeah, yeah. Great question. So just briefly overview for dermatology. I'm sorry if I'm repeating what's already been said, but there's 3 ACGME fellowships in dermatology. One is pediatrics, another is dermatopathology, and the third is Mohs surgery or dermato-oncology. And that third one sometimes includes like cosmetic dermatology and things like that, but purely the board test is for Mohs surgery. And then there's all sorts of non-ACGME approved fellowships that you can pursue if you want to, which include MedDerm, Oncoderm. I think there's a melanoma derm one, there's a CTCL one, and then there's rheum derm as well. So there's a lot of different areas that you can subspecialize within dermatology after residency if you so choose. But I would say the majority of residents after they graduate do not pursue a fellowship and kind of just go into general practice. Which you can do, which is nice. You don't necessarily have to do a fellowship, and you'll have a good life, and you can do a lot. And then in terms of research fellowships and fellowships that are at UCI, we have a Mohs surgery fellow here, and that's the only postgraduate fellowship that we have. And then we have several research fellowships. Dr. Mesenkovska, it depends on kind of what she's planning for that year, but she'll take anywhere between like 2 and like 4 fellows actually. But it just she's a great person to work with and a great mentor. So it kind of depends on what she's like wants to take on for that year. And then Dr. Kelly also, all of our mentors are great mentors. So I don't want to say like every time, but just assume. So Dr. Kelly, she's also wonderful and has a research fellowship as well. Her specialty is more, while Dr. Mesenkovska is hair and autoimmune primarily. Dr. Kelly is lasers and vascular anomalies is kind of her specialties. But so she has one, and then Dr. Smith has a Oncoderm fellowship as well. And with Dr. Smith's fellowship, often you work with our chair emeritus, Dr. Zachary, who is like laser and cosmetics expert as well. I'm trying to think of any others. Oh, Dr. Ganesan also has one, and his is more like a physician scientist track. So often like MD PhDs, because he does a lot of translational research and basic science research as well. You work pretty closely with Dr. Shield in that one as well. And they specialize in vitiligo and pigmentary disorders. Um, I think that's it.
Awesome. Well, yeah, UC Irvine definitely sounds like they do value research, which is amazing. For those students who end up doing a research year at UC Irvine, do they tend to match at UC Irvine? Obviously, there might be like too many of them to match into 5 spots, but do they tend to take research year students, or do the research year students end up matching at other places?
That's a good question. And one that people should think about when they are applying for researchers and things like that. UCI has definitely taken research fellows before. I think this, like in my class, for example, Christine did her research here with Dr. Mesenkovska and ended up matching here. Um, but I just listed like 6 different fellowship positions at least. So of course, not everyone does end up matching here, and it's not necessarily a guarantee. Um, but just like how you do away rotations at places, when programs are trying to select residents, they are trying to get to know you as a person, which is obviously difficult to do in a one-day interview. So people, just like why people match at their home program more, if faculty have more comfortability with a student or an applicant, like I think they are able to build more of a rapport, and you usually have a better chance of matching there. So it's like by no means a guarantee for the research fellows to match there, but just like if you spend more time anywhere, you have more exposure there, and you probably have a better shot there. And it's certainly not a prerequisite to match here either. I didn't do a research here. I didn't do an away rotation here. So you don't need to do a research fellowship here, but if you do, you definitely have a good shot, if that makes sense.
Okay. So while we're on the topic of research years and just research in general, how does UC Irvine look at students who have done a research year or a PhD? Obviously, two different things, but is that something that they value? Is it something that doesn't really matter
Mhm.
in the interview process? How does UC Irvine look at those students?
Yeah, I think that's a good question, and I just want to caveat like everything that I'm saying in this podcast is like these are kind of my opinions. They're not necessarily the opinions of the program, right? Like I do not speak for the program by any means.
Yes, thank
So
you.
from my understanding, yeah, from my understanding, I think that research years and PhDs help you build a resume and help you build a skill set that can be attractive to programs. And UCI, I think, is no different than any other place. That people who have more accomplishments, read that however you want, are maybe more competitive applicants. So there is a physician scientist track at UCI where they try to fill at least one a year. My class doesn't have anyone in that track, for example. But like Dr. Ganesan and Dr. Shu are kind of the leaders of that one. So I think that there is an interest in people who are interested in being physician scientists here, no question. But just like, there's a diversity of faculty, there's also a diversity of opinions. So there's plenty of faculty who are not, full-time researchers. There's some faculty who don't really do much research at all. And then there's some faculty who really, really value it and find it to be incredibly important. So I think one of the benefits of having such a large faculty is that um, everyone's pretty supportive of like whatever you want to do, but B, there's a lot of different people who like have different values, and you can kind of find somebody who matches up with that. So I think UCI isn't different than other places in that like if you find somebody who you really get along with and they'll fight for you, that like helps you a lot. So I think that like doing research years and doing a PhD definitely helps applicants, but I don't think that it's a prerequisite by any means. I think it helps applicants because it makes them a stronger resume to present like as their your ass submission,
Okay,
if that makes sense.
awesome. That's good to know. The last question, kind of in this realm of acceptance and institution and what they look for, and you might not know too much about this depending on how many previous residents I guess you've interacted with, but Do you know UC Irvine if they accept DO or IMG students or if they've done that in the past?
Good question. I do not have like a Rolodex of knowledge of the previous resident. I kind of just know who was sort of before me, and then like a few years before me, and then since I've been here. And we have not had any DOs or IMGs since I've been here, but I don't know what the program stance is on that.
Okay. All right. Thank you. So we'll just jump into training now. And you can just kind of give us a general overview what the structure of the program is. Of course, there's PGY 2, 3, and 4 year. Is it kind of a block schedule or a longitudinal schedule? What does the general schedule look like throughout those 3 years?
Yeah, so it's a block schedule. There's two blocks that are 6 weeks long, and then every other block is 5 weeks long. Um, and you do basically do like, I guess, two of five are at the VA. Like you split the year into, sorry, I'm doing a terrible job of doing this.
That's
You split
okay.
the year into two 5 block halves. So for the first 2 years, two of your 5 block halves are at the VA, and three of your 5 block halves are either at UCI or at CHOC, the Children's Hospital of Orange County, if you're on PEDS, for example. And those UCI blocks can be at any of our satellite clinics or at like Douglas, Maine, if you're on like consults or during PATH, for example. Um, which is nice that I think the 5 week blocks are nice because like, some blocks are harder than others. And you kind of don't lose like the like institutional knowledge that you would if you did like a 10-week block and then you don't do it again until the next year. So that's like what they used to do for the VA, for example. And if anybody's ever worked at the VA, like if you don't log in for 90 days, it like kicks you out. It's a whole nightmare. So it's kind of nice that you like move around a lot because you like are constantly engaged with something new, I guess.
Okay. Do you guys offer any electives or do students go work on other services at all outside of dermatology?
Like residents or medical students?
Residents.
Okay. Yeah, so we offer 2 weeks of elective time, not counting rotation at a Rady Children's Hospital in San Diego if you choose to do that. That said, that deal with Rady's might no longer be there for much longer because we used to not have a full-time pediatric dermatologist on staff, but we have hired one this year who's going to be building out the peds derm program out of Chalk. So I don't know how much longer that's going to last. I think if somebody was really interested in peds, they would still count that as like not one of your 2 weeks of elective time if you want to go to Rady's. But grain of salt there. But for elective time, mostly people use that for like if you have a specific interest or if you're applying to fellowship. So like my class, a bunch of us are applying to most fellowship. We're all using our 2 weeks of elective to go to away rotations at places, which is like really valuable during the application process. You spend like usually like between 2 and 5 days at a place. So it's like a little bit shorter than like as a med student. But like, for example, Shing, who's actually staying on his faculty this year, but he was our chief last year. Um, he ended up going to Stanford and doing CTCL work up there for a couple of weeks because that's his interest. He wants to do CTCL. So you can use it like however you want, but and you get it between second and third year. So you can split it up kind of however you want from there. And then, we have 4 weeks of vacation a year. So if you want to, you can always use vacation to go do an elective too. So I'm doing a little bit of that actually for my like Mozap. I'm using some vacation to go places.
Oh, nice. Okay. So that makes sense. And then I'm not sure if this is something that you guys do, but do you guys ever rotate with like plastic surgery or like things that are not necessarily dermatology?
We don't actually. Um, you do get a half a day of like admin or research time starting 6 months into your first year. So every block you should get a half day of admin time. And you can use that however you want. So if you wanted to go hang out with plastics or oculoplastics or something like that, you certainly could. And I think that they would probably work with you if you wanted to do something like outside of even that structure. But um, I can't think of anybody who has done that. It's
Okay.
mostly just within the department.
Okay. Awesome.
Yeah.
All right. So let's talk about some of the clinical sites. You mentioned that, there was like the Gavin Herbert Eye Institute, and then there's a hospital in Orange and a new hospital in Irvine, and then a bunch of other clinics that you guys go to. Then you also mentioned the VA. So can you tell us kind of what it's like at each of those sites, how far away they are? Do residents need to have a car to go
Mhm.
between the different sites? What is it like at the VA? Just those kinds of questions.
Yeah. Well, so 1,000% you need to have a car. That's anywhere that you're going to go in Southern California, though. It's just the entire region is built around a car. So um, I think that like probably Laguna Hills to the VA is our longest distance, and that'd probably be like a 40-minute drive. Most people live in like Costa Mesa, Irvine, Newport area. So nobody's driving more than like 30 minutes to a clinic, unless there's like really bad traffic, which like sometimes does happen. But it's not, I would say the traffic's actually a lot better than like LA, or even like Chicagoland where I grew up, which surprised me. Um, and the VA, so yeah, the VA is like 30 minutes away. You need a car to get there, you need a car to get anywhere. And the VA, I would say, is a very, very valuable resource, especially for somebody who's interested in procedural dermatology, because you get a lot more hands-on exposure there than you do usually in like a more academic setting. I mean, I shouldn't say academic setting; they're all academic settings. But the VA is like a really great, valuable surgical learning experience. So if you're somebody who's interested and thinks that they might be interested, I would definitely look at a program with the VA. We have great faculty over there. We have three full-time faculty, Dr. Knapp, who actually was in the Navy. So she can relate to a lot of the patients on like a personal level. From there, we have Dr. Brooke Krause, who is a fellowship trained med derm. She is very, very smart, like intimidatingly so, and is a wealth of knowledge. And then Dr. Safadi, who is also like a fantastic med derm, and just like a ray of sunshine. She's like makes the VA experience like a wonderful time, which if you talk to other people at other VAs, maybe they have a little bit less fun. I would also say that our VA is like pretty well organized considering. Um, and the hours are not quite as long as like the UCI blocks, for example. Usually we're there from like 8:30 to 4, um, versus like at UCI, it's usually like 7:30 or 8 to like 5. So like a little bit longer. Um, what else? VA, you see mostly skin of color or like light skinned patients, like especially older patients who make a lot of MSCs. So there's a lot of skin checks there. But you actually do see a decent amount of skin of color there as well. Um, but it's mostly like an older male population, I guess, as you would assume with like any VA.
Hmm.
I'm not sure if I answered your question, but that's my rant.
Yeah. And so they send the residents then to all the different clinics. So you might be at one of the inland
Yes.
clinics one day, you might be at an orange clinic one day. Is that right?
Mhm. Yeah, they try to minimize the like driving between clinics, like from morning to afternoon. But there is some of that sometimes. But like if you're at the VA, you're just with the VA, for example. But yeah, you go to all of them. It just depends on like what rotation you're on. Some blocks you spend more time at JGI. Sometimes you spend more time at Beckman. Like consults during Path, you're just at Douglas the whole time. So it just depends on the rotation.
Okay. Awesome. And then you touched on this a little bit, but can you remind us where you guys get your pediatric experience at?
Yeah. So I didn't talk about Dr. Guide. She's also wonderful. She's a pediatric dermatologist, but she does it all. She does Mohs too. She does gender. And she has a private clinic in Rancho Santa Margarita that she volunteers her time to have us visit her at. So that's a great experience for us. She sees a lot of peds patients there as well as adults and does some surgery up there. And then she also has a clinic at CHOP, Children's Hospital of Orange County, where we see a lot of kids as well. And then we have a new pediatric dermatologist who just graduated from UCSD. She is going to be setting up full time at Chalk, and I think that the peds rotation is going to be changing quite a bit once she gets established. So I haven't done that rotation yet, so I'm not sure exactly how it'll be, but I think that it's going to be a little bit more robust of an exposure than we've had in previous years. Um, and Children's Hospital of Orange County is in Orange, California, so it's a little bit more inland too.
Okay, awesome. So let's get into the fun, strengths and improvements of the program. So from your perspective as a resident now in your last year, what are what are the strengths of UCI dermatology? And then what are, things that they could improve on?
Mhm. Good question. Well, I think that for me, I kind of knew I wanted to do Mohs like when I applied. So I was looking for a place with like a good surgical exposure that had a good track record of matching people into Mohs programs and fellowships. And that's advice that I'd give to anybody applying is to, I mean, you don't have to know what you're going into like when you're applying, but like if you do have an idea, I would look at where the residents who are graduating from that program end up going. So if you really want to be an academic, for example, like I would go to a place where a lot of people go into academia, for example. Or conversely, if you just want to do private practice, you don't want to be in a program who like looks down on that, who like only wants to train academic dermatologists. So I would like look at what the residents have done in the last like 10 years or so and make sure that that program kind of aligns with what your goals are. So for me, that was Mohs surgery, and I think that strength is maintained while I'm here. I think that one of our surgical experience is one of the more robust in the country, at least during my interview experience. I can't speak to every program, of course. I've only done my residency here, but we get a lot of hands-on exposure at the VA. You're doing a lot of layers as a first year in Mohs. You're doing first surgeon closures during your first rotation. Um, and then I think that we have a great cosmetics training program as well. Um, the faculty are very open to it and passionate about it. And then we have, I think, the second most lasers in the country of any residency program. So I think those are two big strengths for us. Our derm path is also, I think, very, very strong. Dr. Bonnie Lee and Dr. Doan and Dr. Skupsky, we have three derm path faculty who gives lectures all the time. Med derm, I think, is also strong. We are a very clinically heavy program, though, I will say. So we see high volumes of patients as residents. Like I think the most I've seen in a day is like something in the high 40s, but like you could expect like an average clinic day to be 15 patients in the morning and then in the afternoon, so 30 total. You don't always end up seeing all of those. So not a lot of times the clinics will see people on their own. But clinic is pretty fast paced, and we do have like a high clinic burden, I would say, which is a good thing in a lot of ways, right? Because you need reps to be good at this and you want to be good at this when you're done. But it is busy for sure and can be tiring. So I wouldn't say that we're like a cush program from that perspective. Um, but, it just depends on what you're looking for. I think that the reps are, you can color it any way you want. I think the reps are overall a good thing, but you do sometimes come home tired. And then I think that one of like our biggest weakness was peds for a long time, which for me, when I was applying, I knew I didn't want to do peds, so it wasn't that big of a deal to me. And a lot of peds derm, quite frankly, is the common things that you will see all the time. And I didn't mention that our continuity clinic, we see a ton of peds because we're like kind of the only dermatology group that takes the chalk call optima insurance, which is like the kind of Medicaid for kids. But you see mostly, normal peds stuff. You see acne, you see eczema, and you're going to get good at that. But like we don't see a ton of the super duper rare stuff. That may change with the new peds derm faculty coming on. And I think that was kind of their goal to like address that. But I would say that was probably a weakness of the program. And then let me think. Yeah, I mean, anywhere you go, you're going to find things to complain about. I think overall our lives are pretty good. Yeah, that's all I got.
That was very comprehensive. Thank you. I think you answered my next two questions, which was surgical and cosmetic exposure. And you mentioned that you guys get a lot at the VA and you're doing first layers, your first year of derm. Also talked about lasers and getting so much exposure at UCI. Is there anything else you wanted to add to surgery or cosmetic experience before we move to the next set of questions?
Well, so one thing that I should add actually is our cosmetic, when you have patients paying out of pocket to get cosmetic procedures, they usually don't want the trainees doing it. And that's not just a thing in Orange County, like you might expect, like um, our patient population here. It's a thing anywhere you go. If they're paying, $1,000 for filler, they don't want the trainee doing it, right? They want Dr. Whoever to do it. So I think probably in clinic, like during the cosmetic clinics, you're doing more watching than you are doing. But once a month, we have a resident cosmetic session where we can do basically whatever we want. Like they have a few patients who come in. You have clinical faculty who are monitoring, making sure everything's safe, that you're doing everything right. Um, but that's where you get probably your most hands-on exposure with things like filler. Botox you do in clinic, but like filler and then like some of the more like intense lasers, so like resurfacing lasers and things like that. We have a couple lasers at the VA that we run entirely. So like vascular lasers, tattoo lasers, some pigment. You get a lot of hands-on there as well. But I think one of the best resources that we have is that once a month resident-led cosmetic session.
Okay, great. Thanks for touching on those. You mentioned this a little bit, but tell us about the continuity clinic. When does that start? How does that work? Where is it? Tell us about your resident continuity clinics.
There's the VA, there is Dr. Smith's clinic, Dr. Bonnie Lee, which is the one that I'm in, and then Dr. Nathan Rojek. The continuity clinics are all, we all take Medicaid, so that's primarily our population base there. We try to save those spots for our Medicaid patients that can't be seen elsewhere. And you start your first week of residency. So the VA and Dr. Smith's clinic are Wednesday mornings, and then Dr. Rojek's and Dr. Bonnie Lee's are Friday afternoons. And let's see what else. Yeah, you basically see a lot of like skin of color and a lot of kids in those clinics. And then in our clinic, we do a
Suite, I guess. So we can book excisions and things like that if we want to, but it's primarily a med derm clinic. And typically it depends on the breakdown, but like you'll have third year, a second year, and a first year. And then sometimes you have like two of one class. So like my clinic right now, there's two third years, and then we've been in this all 3 years, of course, and then one second year and one third year. But it just depends on like, you know, the rotation,
Yeah.
like when they're filling them out.
Okay, cool. Do you guys have any global health opportunities? Do any residents go overseas
Yeah,
or anything?
good question. Yeah, they definitely did. Like there's like those like AD like global health programs, and they definitely like before I got here, Dr. Sharma, who's actually on staff now, I think she did something. I don't know, to be honest, because I haven't looked into it because like I always knew I was using my elective time for like most stuff. But they definitely like do allow it and support it, and people have done it before, but nobody's done it in the 3 years that I've been here. So
Okay. Okay.
yeah.
Um, a few more questions about resident life. Can you tell us how much autonomy you feel you guys get as residents?
Good question. Super dependent on the clinic, on the attending and the setting. So in continuity clinic, as you would expect, you get a lot of autonomy. It's like your patients, right? So like Dr. Rojek's clinic, for example, it's like the patients aren't actually under Dr. Rojek's name; they're under the resident's name, and they're your patients that you follow up in. Our clinic, Dr. Lee's offered to let us do that. We don't want to, just because it makes scheduling easier. So we do more of a grab bag. But the continuity clinics, generally speaking, you get more autonomy. And then it depends on the attending clinic for UCI, how much autonomy you get. And then it also kind of depends on your year of training because it's very much like a graduated autonomy. As a first year, like, you just don't know a lot. Like it's impossible to, right? You just came off a year of medicine and they don't teach a ton of derm in med school. So it's mostly like following the attending plan. But as you like kind of learn more and grow more, they'll like sort of let you um, pitch your plan and then they'll either go with it or not, depending on like their level of comfortability. And then at the VA, you get a ton of autonomy, especially as you get older, or I guess not older, but more senior within the residency, both in med derm and in surgery. So I would say, yeah, it's generally graduated autonomy. Some of the attending clinics less so than others, but the VA is like, and continuity clinic, you get as much autonomy as you want. But we have faculty who are always there for you if you need them to be.
Okay. And the last question in this section is how consults and call work. I think you mentioned that, you do consults at the hospital, obviously, but how often are you on call? How often do you have a consult month? How does that work in your schedule?
Yeah. So you do consults during second year and during third year. It's 5 week block. You are primarily based out of Douglas Hospital. Now that they're opening the new hospital, I don't think that they've decided kind of how that's going to work in terms of seeing consults there. Because it's like brand new. Like it's actually not finished being built, just the outpatient center is done, and that's where I was today. But I would say that our consult volume varies, like any program. We get probably between like 1 and like on the high end, like 6 consults in a day. So it's probably one of the more chill rotations where you get more time to study or do your admin work or research or whatever it is that you want to do. You're granted a lot of autonomy on that rotation as well because you're a little bit more senior and you work primarily with Dr. Linden and Dr. Rojek, and they really want to foster that. So you can kind of make of it what you want to. Your hours are from 8 to 5. And you don't necessarily have to be at the hospital during all of those hours, but you do need to pre-round on your patients and then see the consults obviously that day. So sometimes people will, miss the morning traffic, take the first couple hours from home, do their coffee, breakfast, whatever, and then go pre-round and round and all that stuff. And then for call, because we have 5, so it's 5 residents a year, you start taking call during the back third of your first year. And then you finish, at that same time during your second year. So between the 5 of you, you split up the 52 weeks. So you take 10 weeks of call throughout residency. And it's not that bad. You almost never go in at night. That's just like the culture for us. Like if you get consulted at night, most things in dermatology, even things like SJS, TEN, you don't necessarily need to see at that moment because like the treatment is like stopping the culprit drug. That's like the most important thing, for example. So if that's something you suspect, you tell them to stop the culprit drug. And then we do like IVIG here, but that's like semantics. So then you can just go and see them the next day, but you like prep the note basically. And then you like answer like patient calls after hours that are like after hours emergencies. So it's really not that bad. You don't always have to go in on the weekend and you just do 10 weeks.
Okay, that sounds good. We'll go into research, resident research. So I'll just ask a general question. You can take it away however you'd like. But what are the research requirements? What opportunities do they give you? And what does the financial aspect of it look like? Do they support you, going to present at conferences? Do they help you out with grants? So tell us everything that you'd like about research.
Yeah, good question. So we get a $1,500. We're like part of the union, right? We have a union here, so like our like benefits are pretty good for like a resident perspective, I would say. And part of that is we get, I think, $1,500 a year for education. So you can use those for conferences, or you can use those for like, I need to buy a new laptop, or I need a dermatoscope, or whatever it is. You can use it however you want. So that's like the financial support to apply to conferences and things like that. And then you can do like a research swap. So I mentioned that like half day of academic time that you usually get. So you can take, instead of doing that like on a Tuesday, like you're assigned or whatever, they'll assign you to a different clinic on Tuesday. And then you can use that time on Friday to fly to a conference and go. And that is only limited by like scheduling. So like if too many residents are out, then it makes it difficult. But like there's no like hard and fast rule where you only get to go to 2 conferences or something like that. It just kind of depends on like who's out and stuff like that. And they'll try to work with you to make it work. It's just like, there's certain clinics that need to be covered. So as long as those clinics are covered, they'll make it work for you. And then everybody, I asked this a lot when I was like going through interviews, like everybody gets to go to AD. They give you 2 days off for it, or 3 days off for it actually. As long as you submit something, which is easy. They'll kind of like set you up like a gross and micro thing. and that's a lot of fun. We like usually stay together like in a big house. It's like a residency program, like just the residents, obviously. And it is a blast. So that's really cool, except one resident, usually the first year, because they usually take over just before then, has to stay back to cover consults. So somebody has to be on consults at any time. Um, but you know, they usually get like one holiday less or something if they do that. And then research requirements. They do want you to do a longitudinal research project. Like you present on it every year, but I would say it's pretty variable on like how much research someone does. Like I don't think that there's like a publication requirement or anything like that. And there's definitely a lot of support for research. So if that's something that you're interested in, like we have a robust basic science faculty. We have a really robust clinical research faculty. like I said, like a lot in lasers, and then my interest is in surgery, so I've worked with Dr. Lee a lot. Dr. Messenkoska is an outstanding mentor, and then like a lot of case reports, of course, like any program. And you're definitely encouraged to do it, but like it's also not something that like you need to do in order to be a successful resident here. Like there's wide variance on how much people are doing. Like I know one resident is publishing over 10 things a year while they're here. And then I know another resident who graduated not too long ago who didn't publish a thing, So it just depends on, it is what you make of it, basically.
Yeah, a lot of flexibility, which is good.
Yeah.
Okay, great. Next thing, just a quick touch on didactics and preparing for exams in dermatology. What do didactics look like? Are they resident led or faculty led when they happen? And then do you get admin time for studying?
Yeah, it's a good question. We do get the admin time starting back half of first year, half day a week, which is really nice and important. And then I like that you asked, is it resident led or is it faculty led for didactics? And when is it? So our didactics, we have Friday mornings protected, which is really important and really nice, I think, because that's time that you don't have to be like working in clinic essentially. And I would say that our didactics are like 90% faculty led. We do have resident lectures, but luckily we've had really great residents in the past, and we have like a Google Drive of old lectures. So it's really just updating those that you do before you give the lecture. So it's not like starting from scratch, opening up Bologna and making an hour talk by yourself. It's just like you update the talk and then you give it. But primarily, like we have a lot of faculty-led lectures, both from guest faculty and like like our experts here. So that's really nice. And then it's four hours Friday morning. So usually between 8 and noon, and then you drive to continuity clinic or whatever you have in the afternoon. But occasionally, if somebody needs to start early, you start at 7 and then end at like 11. So it just depends.
Okay, yeah, having that protected time I feel like is really important, because then you can just be like very focused on the didactics those few hours. So it's good to know.
Totally. Yeah.
Let's talk a little bit about program leadership, who, the chair and PD, APD are, in your experience, if they're receptive to feedback and changes within the program. And then we'll go into one more question regarding leadership, but let's just start with that.
Yeah. So Dr. Kelly is our chair. She is a laser expert. She's the former PD of the program. She like wrote the laser chapter in Bologna. She's great. She is a very caring person. I remember I actually worked with her on my very first day of residency, and she introduced herself as her first name, like, "Hi, I'm Kelly. Nice to meet you." And I was like, "I'm calling you," or "I'm Kristen. Nice to meet you." And I was like, "I'm calling you Dr. Kelly. Like, I'm not calling you Kristen."
Like I can't do it.
Yeah, exactly. So she's like super duper down to earth, very kind, and really cares about both the faculty and the residents' perspective. Definitely open to feedback. But I think that she's sometimes like in a hard place for like certain things, just because like we are part of the University of California system. And with that comes like a lot of bureaucracy. Like we're not just UCI, we're University of California, which includes like UCLA, UC Davis. So there's like certain like regulations that we like have to follow just because it's like a University of California like policy. So I would say she's definitely open to feedback, but we operate within the system. And then our program director is Dr. Bonnie Lee. She is a superstar. I think she's one of the best assets in the program, no question about it. She came over from Ackerman, which is like a prestigious derm path lab in New York. And she's just like very organized, really cares about resident teaching and resident learning, is always open to feedback and will like sit down and explain something to you. Like I've definitely gone into her office and they're like, why are we doing this? This is stupid. And then like she'll like explain like all of the layers on why that has to happen and like how much thought has gone into that. I'm like, oh, okay, my bad, I'm stupid. You know? So
You just needed to
she's great
learn.
too.
That's fine.
Yeah, exactly. Yeah, yeah. Or like I didn't understand that, like,
Yeah.
this, administrator is doing this because of this reason, whatever it is. Um, and then Dr. Krause is our APD, and she is like a literal angel on earth. She's just a very, very good person. So I like her program leadership a lot. Oh, and then Pat Lee is our surgical director. And he's like my mentor. And I don't have enough good things to say about him. He's also great. I'm not like trying to sell it. It is a good program, and I do like our people here. Yeah, and then I would say that a lot of the kind of day-to-day things that affect residents are actually led by your chief residents, who you vote on during their second year. So like scheduling and things like that is primarily driven by the chiefs. And same thing with like didactics and like what talks residents have to give versus what talks faculty give, the organization of the didactics, what your weekly schedule is going to be. They like work on the calendar schedule for the breakdown of the rotations. So the residents have a big role to play in kind of the resident experience.
Awesome. So as we're talking about residents, can you tell us what role you guys play in the interview and the match process?
Yeah, so the two chiefs interview, and they sit in on the delegation meeting. My understanding is that the match process is very democratic, so one voice doesn't weigh more than another. And you interview with a large part of the faculty. It's a full day interview by Zoom, which I think is actually kind of a detriment of the program, because Orange County is a beautiful place, especially when you're interviewing in like January. So people don't necessarily get to see that, but it's like a University of California policy, which is why they do it that way. So the chiefs are part of that. And then the first years actually interview like each class, because they will be the chiefs when that class is first years. So second years don't really play a role. And then like non-chief third years don't play a role either. Other than like for away rotators, we all get asked like basically our opinion on them, like after they rotate. So yeah, like if you have like a good connection with somebody, it's not bad for you if they aren't like a chief or a first year, because like every we always talk, like when the interviews are coming out and the interviewees are there, like people are like, oh, I really liked, blah, blah, blah. So like you guys should rank them highly. So even though like they're not necessarily in the room, like those opinions still get expressed.
Okay, that is great to know. All right, now into the fun stuff. We're nearing towards the end of the interview. Tell us about resident life, what the culture of the program is, kind of what y'all's personalities are, and what you guys do for fun as residents.
Yeah, I would say we have a pretty good culture as a residency here. We do like a couple big trips every year. Like I organize the ski trip. We go to Big Bear every year. Like this year, we rented out like a huge mansion up there. There's like a jacuzzi in there, and there's like 15 rooms, and we just spent the weekend, went skiing one day, had a great time, and we're all good friends. Most of the time in clinic, you're by yourself with the attending, but like certain clinics, like continuity clinic, and then also the VA, it's like a grab bag. So, you know, we're kind of all in it together. So if somebody is dragging, for example, like that kind of makes somebody else see more patients. So it's definitely like a culture of camaraderie, because like you need to be, together to kind of like have a good experience, especially in those clinics. And then we do like dinners a lot and stuff like that. I would say our faculty are also pretty laid back. It's definitely not super duper hierarchical. Yeah, it's a good program. It's definitely not like super duper small. Like you definitely can get through without knowing like a certain faculty super well, just because it is like a relatively large faculty. But everyone who's here is like in academics for a reason. So if you click with somebody, if you vibe with somebody, like they are almost always going to be a great mentor. I think one thing that's really nice is they'll support you no matter what you do. If you want to do academics, if you want to do private practice, if you want to do fellowship, you will find support here, and nobody's going to kind of like look down on you, which is really nice. Yeah, I think that's all of my points.
Okay. In regards to where residents live, you mentioned like most people are Costa Mesa, Irvine, Newport.
Mhm.
Are people
Yep.
buying houses, renting houses? Obviously
Yeah,
it's
you're not
Orange County. Yeah.
yeah,
I was gonna
yeah,
say,
you're
yeah, I
not
was
buying a
gonna say,
house and
and not
like
in residency. Yeah.
unless you like,
Later you can,
unless
but
you're like independently wealthy, but yeah, it's
exactly.
like a two-bedroom here is like $1 million, so like it's
Yes.
yeah, it'd be tough to do. But yeah, most people rent. A lot of people live with roommates, either like their partner or like I live with AJ, one of our classmates. Some, you can also definitely afford to live alone too. Like I said, like our salary is pretty good. I think that's all posted on our website. Um, and most people do live in like Orange County proper. So like you said, Costa Mesa, Irvine, Newport. Some people live in Orange, and then we have one person who lives in Long Beach because his wife is a USC plastic surgery resident. They kind of like split the difference in that way. And then we have another resident who lives in LA proper. Actually, she lives in Culver City because her husband is a UCLA plastics resident. Um, so people, make it work, and she just commutes. But I would say the vast majority live in like Orange County proper, kind of Costa Mesa is like the central area.
Okay. And then do you guys get a housing stipend?
You do, yeah. I want to say it's like 8 grand a year, but it like just goes into your paycheck. So like
Okay.
I don't get like a separate housing stipend. It's just like part of your paycheck.
Okay. And
Yeah.
then kind of the last thing within resident life is, do people have kids? Are they married? You mentioned a couple people being married. Does the
Mhm.
program support paternity leave and maternity leave, people having kids during
Mhm.
residency?
Yeah. Well, I mean, we're in California, so like it's a pretty like well supported like culture in terms of paternity and maternity leave. That said, you are limited by like the ACGME and ABD. So I think that like the UCI policy is actually more lenient than those two bodies. But like whatever the least lenient thing is, like you're only allowed to. I don't know exactly the rule, but you're only allowed to miss like X amount of weeks during residency, and like you're allowed to miss that maximum that like the ABD or ACGME allows here. So I know that one of our first years, his partner is now expecting. So I suspect he'll take paternity leave. Nobody's had to do that while I was in residency, but it's definitely like supported. And then there is one other first year who has 2 kids right now. And I think she's doing well. I don't know. I think having kids probably tough, regardless of what stage of life you're in.
Yeah.
But yeah, that's the only one. But
Okay.
all comers, I came in single, met my partner here. Other people come in married.
Yeah. It's good mix of people.
Yeah.
Is there anything else you wanted to talk about in regards to resident life? You kind of touched on Big Bear and having LA and San Diego
Mhm.
close by, which was really fun. Anything else that you guys do for fun as residents that you wanted to touch on before we conclude?
Um, yeah, I mean, there's like whatever you want to do, there's that here. So like I'm really close to my class. I'm lucky in that sense. So we do like board games, we do like dinner nights, and like I've hosted like a birthday party at my house a few times, which is fun. We do like either a Christmas party or a Halloween party every year, which is also fun. And then it's just kind of like, whatever you're interested in that you have that here. They have like more of a going out scene. They have a little bit of a foodie culture. We actually have a few Michelin star places in OC. There's lots to do outside in terms of hiking. There's beautiful beaches. There's surfing if you're into that. Pickleball is a big thing. I like playing basketball. I play in like the Newport Beach Men's League. Um, yeah, whatever you want, there's that here. Like I definitely was worried when I like matched here because I came from New York City and Detroit before that, which are two like proper cities, you know, and like OC is like a little bit, at least in my head, is like a little bit more suburban, which is true. Like there's definitely like less like, you know, the public transit isn't like super feet like workable. So you definitely have to drive everywhere and things are like more spread out. But it's still like 3 million people in Orange County. So it's like a dense population, you know. I think it's like the sixth biggest county in the nation or something like that. So there's still like a lot going on and a lot to do here. So whatever you want, you can find it here.
Okay, sounds great. Sounds fun. You mentioned obviously your website, and I'm assuming that's the best place that applicants can go to learn more about your program, unless there's somewhere
Mhm.
else that you recommend.
Follow us on Instagram. Thea is running our Instagram. She's one of our residents. She is really good at it. So a lot of fun updates there. There's like two programs, or there's a few different Instagrams you can follow if you wanted to. There's like UCI Durham Research, which is basically Dr. Mesenkovska and her fellows. She's really fun. There, I think is UCI Durham Residency, which I think is Thea. And
Yeah.
then I think there's just UCI Dermatology, which is like our official one, like by the program.
Mhm.
So that's good. And then our website, I think, is now up to date. It wasn't always the best, but I think it's good now. Um, and
New
they should
hospital,
have
new
like,
website.
yeah, exactly. Yeah, we're upgrading everything around here.
Yeah.
Um, and then, you know, you can always just like reach out via email too. Tarina is like our program coordinator and she'll forward you to the right places. Um, yeah.
Okay. Last question is, what advice do you have for medical students interested in dermatology, and what advice do you have for them in choosing a residency program?
Okay. I'll try not to talk too long. Um,
Yeah,
the
this can go
interested in
long.
dermatology. Yeah, no, it's like a big thing. I feel like I've been talking for way too long in this thing in general, but
No, no, you're
uh,
good.
interested in dermatology. Unfortunately, it's gotten to be kind of a competitive specialty. I remember when I was applying, every time I went to like a derm interest group thing or like whatever, like I would always leave being like, I'm never going to match. I'm like so screwed. But it is attainable, and like you should feel like it's attainable. You just have to show interest and start early, you know. And if you don't start early, you know there are research years and things like that that you can do to build your resume if you decide later during your process. I think that the check boxes that you all know about are real, but like if you're missing one, it's not going to be the end of the world. Like these are all things to like bolster your resume, but it's not like a make or break. So, you know, like your AOA, your honors, your high step score, your research experience, all of those things help you match, but it's not like missing one, two, or three does not mean that you can't match, if that makes sense. I would definitely try to find a mentor if you can that will speak strongly to you for your letters of recommendation. I think that goes a long way. Um, and then I would try to be productive, especially now that step one is pass fail. I went to Wayne State. It's a good med school. I was very happy there, but like it doesn't have the name of like a Harvard or Yale, something like that, that like gets you in the door based off of the name. So for me, step one was helpful for me because it's like, listen, I took the same test as those people, right? So now I think that goalpost has changed a little bit. They're still going to try to compare people, you know, apples to apples if they can, but now they have step two, and they have research really, right? And then they have connections, so like your mentors and things like that. Because even like honors and AOA and things like that, some schools don't have that. Some honors are much easier, frankly, than others. You know, so it's hard to compare those. So you know, we're blessed in dermatology that we have a lot of people applying, but it also makes it like a little bit of an intimidating process. So you just want to set yourself up as best you can, you know. Um, while I know I'm being contradictory, also understanding that it is attainable and that you are good enough, you know. So try not to beat yourself up too much, but also just do your best. And then try to find a mentor early on and be productive, I would say, from a research perspective, because, you know, a JAMA publication is a JAMA publication, regardless of where you're coming from, type of thing, you know. And then in choosing a residency program, the first thing I'll say is try to understand what your goals are for post grad. So for me, again, I wanted to do Mohs. So I ended up ranking UCI number one because they had a great Mohs match for the last 10 years. And they had a really great surgical experience. So I was like, that's what I want to do. And then there's all these other factors that matter to me, right? Like, where am I going to live? What's my life going to be like? What am I going to do on the weekends? Like what sort of opportunities would I have there? And that's like kind of what mattered to me. But if your goal is to be a general dermatologist and work in private practice, which is a great goal, um, you're going to get that training, you're going to get that credential wherever you go. Like any residency program, regardless of like the little like rankings or whatever that are on that like Reddit spreadsheet, is going to prepare you to be a dermatologist. So that's where you want to think about like, where do I want to live? What would I be happy doing for 3 years? What's the program culture? Like those kind of like more soft traits that do matter. Because like at the end of the day, like, whatever like tier of program or prestige of thing isn't going to matter so much if you're miserable, right? Like you're still having to live your life there for a few years. So I think location and like program culture and like where your friends and family live, for example, is something to consider and shouldn't be overlooked by any means. So um, that's my spiel. Yeah. Think about what you want to do afterwards and then base your decision off that. And then second, go where you're going to be happy in terms of like location.
I think those were great tips, honestly. It is really a balance of like knowing it's competitive, but also knowing that, hard work pays off. So
Yeah.
I really appreciate you taking the time. Well, that concludes our interview. Thank you, everyone, for listening. And truly thank you, Luke, for taking an hour out of your very busy life as a resident to talk to students about your program and to, just tell us about your experience and give us some tips and tricks. So we really appreciate you. Make sure everyone to like and subscribe, share this video with other people applying to dermatology as well, and have a good rest of your week. Thanks, Luke.
Thanks for having me. That was fun.